Welcome to Evergreen Family Medicine. Today we are with Dr. Emmanuel Okenye, and we wanted to get to know you a little bit. Welcome to Evergreen. Welcome to Roseburg.
Thank you.
Tell us a little bit about yourself. For instance, where are you from?
My name is Emmanuel, as you said. I am from Nigeria originally. I moved to the U.S. for college and went to college in Tennessee, medical school also in Tennessee.
And here you are in Douglas County at Evergreen Family Medicine. Take us from Tennessee to how you wound up here.
Worked for a few years, about a year or so in between. Then I moved over to University of Kentucky where I did my residency training. And Kaylee, my wife, is from here in Roseburg, and she was really having the inclination to move back home.
Talk about your role at Evergreen and what your impressions are of Evergreen Family Medicine.
Well, so far I've been quite impressed with Evergreen. Everyone just seems to be just so welcoming. I have felt like everyone really that we all work together really well. You're very free to ask questions. It's like a big family. And even though we have these two campuses, the Harvard campus and we have the Edenbower campus, so many times it's hard to even tell the difference because we all just, it's just such a mutual, just such a great relationship between both places. And so, I've really had a good time.
What are some of your hobbies? You like the outdoors? And it sounds like maybe this is the first time you lived in the Northwest, so close to the ocean, Crater Lake. Hopefully you've gotten around a little bit and seen the sights.
Exactly. Yeah, we've actually gotten to explore a little bit. We hiked we hiked Mount Scott not too long ago, and we've been to the ocean several times, and it's just such a peaceful, environment, just such a peaceful lifestyle, really. So much to do outdoors. I never really was an outdoorsy person, but I have really had a good time picking up some of this hobbies, and I look forward to actually doing more in the winter. Going out skiing. See if I make it.
Well, hopefully you'll have a good teacher with you, and a good doctor.
Maybe you can be my teacher.
No, I would not be a good teacher. If I am your teacher, you will need a doctor. If I'm teaching you how to ski. So I've also noticed that you have D.O. behind your name. What is that referring to?
That's a good question. So DOs, as opposed to MDs, is just a philosophical difference, really. It basically, you are looking at the body from just a slightly different perspective as to the self-healing qualities of the body, like looking at the body as a system. DOs tend to want to look at how the body kind of fits together, and even though we still would go through the same medical school and research and everything as our MD counterparts go through, we also have a specific class that we have to take called osteopathic manipulation, which is a class where we learn how to manipulate patients and help them treat common conditions like low back pain and mostly chronic pain conditions, and without necessarily having to be first thinking about getting a pill first. We think about how can we help these tissues, these dysfunctional tissues mesh better, sort of like that, just helping the body kind of work better together first. And then, of course, if that doesn't work, then we begin to think about, okay, what are other more invasive strategies, ibuprofen, pain medications, and stuff like that. So really, it's just a philosophical difference. Right now, there's not much of a difference anymore, technically, in the sense that the board certifications and we still get licensed and board certified by the same organization.
Yeah. All right. Well, thank you once again for your time. Welcome to Roseburg.
Absolutely. Thank you.
All right. That's Emmanuel Okenye, D.O. Dr. Okenye at Evergreen Family Medicine, from Nigeria to Tennessee and Kentucky, and now here in Roseburg. We have biographies of all of the providers at evergreenfamilymedicine.com. And of course, you can always follow Evergreen on YouTube, Instagram, Facebook, and Twitter.